So I think most people are aware that dementia, and in particular Alzheimer's disease, are quite common, especially as we age. In fact, the prevalence of Alzheimer's disease doubles every 5 years after age 65, and Alzheimer's disease is the most common form of dementia. Most dementias being either some combination of degenerative disease and vascular or blood flow disease to the brain. Alzheimer's disease is the most common degenerative dementia. And up until recently, we mainly diagnosed this based on clinical testing. So, interviewing patients in the office, examining them, and coming to a conclusion that Alzheimer's disease was or was not the most likely cause of memory loss or dementia. But recently, there have been new medications developed which require more precision in making the diagnosis. And so imaging studies of the brain have been developed that help us there. Many people are familiar with CT scans and MRI scans of the brain. These are images that show brain structure. They tell us what the brain looks like. There's another imaging test, less familiar to people, known as a PET scan, positron emission tomography. And this test really looks at brain function rather than brain structure. When combined with CT scanning, it shows functional changes or components of the brain and tells you where those functional changes are taking place. In Alzheimer's disease, one of the most common changes in the brain is the deposit of abnormal proteins into brain tissue, something we call beta amyloid, or just amyloid for short. And so what a PET scan can do, especially when combined with CT scanning, is show where in the brain amyloid is deposited. And so when a patient comes to us with complaints of memory loss or other sorts of behavioral or functional disorganization that might be suspicious for dementia, if we do feel like the office testing is compatible with early Alzheimer's disease, then we can now order this new imaging test known as a PET CT scan that shows us whether amyloid is present in the brain and gives us some quantitative idea, some numeric idea about how much is there. And so that helps us to establish that Alzheimer's is the cause for that dementia, and it may open the door to being able to use one of the newer medications.